I'm Dr. Jayachandra, working as a senior interventional pulmonologist in Care Banjara Hospitals. Now, questions have been asked quite often. When do you consider lung cancer as a diagnosis? When do you think about it? How does one present with this particular disease? Or what makes us think of the possibility of a patient having lung cancer? Essentially, what are the symptoms? No patient comes and tells me that, listen, I've got lung cancer, please treat me. So we need to evaluate, and how does one usually present to a pulmonologist with this probable diagnosis? One of the commonest thing is cough. A cough which refuses to go away with regular treatment. You've been to your GP, he's given you something, it's not settling down. More than a week now, more than 10 days, it's not settling down. Probably it's a good idea to go and see a doctor. And probably he would direct you to a specialist if he feels that there is need for investigations for that. So cough becomes a dominant symptom. Other thing is weight loss, unexpected weight loss. You've been okay. You've been a smoker in the past. You gave up about 20 years back, but suddenly you find that you're losing weight. You don't know why. You're eating well, you're doing everything. You're feeling unusually tired. That's the other one, which makes a patient approach a doctor. Or for no rhyme or reason, and suddenly one day you cough and suddenly you find that there is some blood in the sputum. This is another alarming sign, and it should alert the patient to go to a specialist immediately. Immediately in the sense that within the next 1 or 2 days or at the earliest possible time. So now we have symptoms of cough, coughing up blood, losing weight, or the other thing is chest pain. Unexplained chest pain, and suddenly whenever you breathe, you're getting pain in a particular spot. You don't know what it is. You try to take a couple of paracetamol or similar tablets or painkillers. It hasn't helped. Yes, you need to go and see a doctor again. Now, when you present to a doctor with almost all these symptoms, whether it is cough, hemoptysis, that is coughing out blood in the sputum, or losing weight, or chest pain, or any one of those things, or getting breathless, that's the other one. Or you could be presenting with fever. With any of these symptoms which are not responding as they should within a week or two, definitely mean that they need to be investigated. Now you go to a GP, but GPs usually do not go beyond giving the usual prescription for a week or 10 days. And then they say, no, I think it's time for you to go and see a specialist. Maybe after an X-ray or maybe without an X-ray also. Okay, now you present to a pulmonologist saying that, okay, I have all these problems. I've smoked in the past and this is what I'm having. And how does he start going about it? First, he will talk to you, he will take a detailed history about what it is, your family background and everything else, and then we start with the clinical examination. Okay, is there any suggestion of fluid accumulation in the lung? You find that there is some kind of a, asymmetrical breathing pattern. That means there is a little less air going to one side of the lung, one side of the chest. Any one of these things which will put the doctor on the alert, saying that, hey, there's something going wrong here. I think we need to do something further. What is the next logical step? You get a chest X-ray. These days we have only digital X-rays. You take an X-ray, maybe from the side view and a straight view, two of them, you look at it, then we analyze the whole thing and then get on to the further analysis. Then you decide on the chest X-ray there's a spot which requires to be seen, and then we decide, okay, this gentleman requires, or a lady in question, may require that they go in for a computerized tomography, that is CT scan. Now get a CT scan, and what is a CT scan? CT scan is again a radiological picture of the entire chest in three-dimensional view almost. So you get a complete detailed study of the lungs. You can study them in different, aspects. the air passages separately, you can see the lung itself, you can see separately, you can see the covering of the lung, you can see whether there's fluid, whether there's a tumor, whether there are some lymph nodes or whatever it is, you can see all these things on the CT scan. And that is when the CT scan dictates the next course of action. What is the next course of action? If you find that there's a tumor somewhere, probably that is the time you decide that, yeah, I would like to do an internal examination of the lungs. And how do I do that? I do it with a bronchoscopy. Bronchoscopy is a small tube with a light at the end of the tip with a CCD chip. You put it along the natural passages, that is into the air passages, navigate your way through to the spot in question or where the tumor is expected to be there, look at it. If you can find it, you can sample it right there. You take 4-5 bits from there and send it for analysis, what we call as a histopathological examination. That is where we are going to get this. Sometimes we don't see a tumor, but we know there are plenty of lymph nodes. Then what do? Then what we do is we do what is called as a endobronchial ultrasound. Go in, put in a needle with the help of the ultrasound, go into the tumor, take the material out, send it for analysis to know where we stand. So essentially for the diagnosis of lung cancer, you do endoscopy, that is bronchoscopy, you do endobronchial ultrasound and do a needle guided biopsy from there, or take the washings from the lung, or in some cases, excuse me, if there's some fluid in the chest, you put in a needle under local anesthesia and take the fluid out. Thank you.